Welcome back. You're watching Sunrise only on E. Many South Africans suffer daily with the debilitating effects of migraines. The main aim of Migraine Awareness Week, which starts today until the 9th of September, is to make the public aware of the prevalence and symptoms of migraine headaches. Many sufferers are not even aware that effective treatment is widely available. We're joined in studio by Dr. Shevel, who's the chairperson of the South African Headache Society and pioneer in the study of migraine headaches. Thanks so much for joining us, Dr. Shevel, and welcome to the show.
Thank you very much, Cindy.
Migraine, well, this is a chronic severe headache. You can't just pop a pill for it, can you?
There are certain medications, but they don't work very well in most people. But a migraine is a very severe headache, accompanied by nausea, sometimes vomiting, light sensitivity, sound sensitivity, and certain other symptoms.
Why do we even have to have a Migraine Awareness Week?
Migraine is probably one of the most prevalent conditions affecting humankind. 18% of women, 6% of men are migraine sufferers, and that's across the board, in all countries, in all socio-economic brackets, races, etc. So it's very, very prevalent and is very underdiagnosed.
All right. Is it because of chemical imbalance? What causes one sufferer to have more severe symptoms than the next?
Cindy, there are so many different aspects to migraine, and that's why we're doing this migraine research to try and find to try and ascertain the chain of events and to unlock the migraine code.
So it's not genetic?
There is a genetic tendency, yes. If your parents have migraine, you've got a much better chance. But somebody whose parents don't have migraine can also get it. So it's not purely genetic.
All right, it could be lifestyle related as well, or external factors that could influence this.
Certain triggering factors like stress are very, very important. But then one has to understand, why is stress? How does it trigger the migraine? What is the actual process? And what it does is, when you're stressed, your muscles tense up more. So the muscle tension part of migraine comes into the equation.
All right. Talk us through the breakthrough in surgery and the research that you've done.
Well, we've been able to prove now that there is vascular pain in migraine. This we've known. In other words, it comes from the blood vessels. That's one of the components. And we've been able to prove at the headache clinic that the pain comes from the blood vessels on the outside of the skull, not from the inside. And because we've made that particular breakthrough, we've been able to treat these things, these blood vessels, by surgery because they're accessible. So we've developed a surgical procedure to cauterize the particular blood vessels that are causing the pain. And when we've diagnosed the patient definitely as suffering with that pain, and we do the surgery, that is a permanent cure.
Wow.
And it's a big breakthrough, and it also forms part of this chain of events, and one is then able to break the chain.
All right, but let's talk about accessibility and just whether, you know, it's accessible to the general public. I mean, if you talk surgery, one imagines that it would be quite a bit of money.
Well, it all depends on how many vessels have to be done, and how long the patient is in theatre, etc. Sometimes they can be done under local anesthetic. So it varies really from patient to patient.
You just say that it's underdiagnosed. What's the effect of it if it goes undetected or
most
not
people
treated?
don't know that they've got migraine.
Yeah.
They just go, they get a severe headache, they go to the chemist and they pop some over-the-counter medication, which is another thing that we want to bring to the attention of the public in Migraine Awareness Week, and that is that all the medications one takes for migraines or severe headaches actually in the long run make the headaches worse. They cause what's called medication overuse headache. So there's a vicious circle. The headaches get worse, so they take more and more tablets.
Yeah. All right, and it's not prevalent amongst kids, or is it more in adults?
Children have migraine as well, but in little boys and little girls it's even numbers. As soon as the girls reach puberty, it goes to 3 to 1, because they have that additional migraine hormone trigger.
So we're saying that during this week we encourage everybody to at least have themselves diagnosed or checked if you do suffer from...
What we want them to know is that something can be done. it's not just to take pills. They should have a proper diagnosis and have something done about it. We can now prevent migraine in most patients.
All right, fantastic. Dr. Shevel speaking to us there about Migraine Week. Thanks so much for coming through this morning. We're speaking to Dr. Shevel from the South African Headache Society, speaking about the awareness around migraines. It starts today until the 9th of September. Now, though, let's take a look at our daily quiz competition.